good afternoon. My name is Gloria Malone, and I'm talking about today infections or chapter 24. Match the two parts of the sentence, locate the A and B, and see opposite to help you. In 1988, so the UK launch of life attenuate is matched with measles, mumps, and rubella vaccine. Um, Chickenpox or varicella is a common infection disease of childhood. Rabies has an incubation period ranging from 4 days to many months. The patient remained febrile, is matched with peaks of temperatures of 39.5 Celsius. He was admitted with a 4-day history of influenza type symptoms of fever with rigors, myalgia, and general malaise. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. The central part of Africa is in the midst of an epidemic um, of AIDS. Measles rubella is most infections during the catarrhal stage. Lyme disease is caused by transmission of B. Burgdorferi from animal to man by exotic tigers. PUO stands for pyrexia of unknown origin. Complete the case, report on the patient in A opposite, look at A, B, and C opposite to help you. On examination, he looked on well. His pulse rate was 100 for a minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 or 13 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood form in his blood film. 3. An injection which can be treated successfully with antibiotics is curable. Another word for an epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normally is pyrexial. The common infection with Epstein-Barr virus is known as glandular fever. 25 or mental illness. Complete the table with words from A, C, and D, and E opposite. Noun and adjective. Affect, affective, anxiety, anxious, behavior, behavioral, demential, demented, disturbance, disturbed, suicide, suicidal. Point 2. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, um, physiomotor, okay, physiomotor retardation, sleep disturbance, substance abuse. Point 3. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with a gene is called senile dementia. Okay, it's senile dementia. A disorder which is not associated with pathological change is functional. An idea which forces a patient to repeat unnecessary actions is a compulsion. Which symptoms of depression was this patient suffering from? Okay, look at the opposite to help you. A 50, sorry, a 56 years old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. Okay. She has tiredness or fatigue. She has sleeping poorly or insomnia and loss of inter loss of interest. The nervous system or chapter 28.1. Adjective noun. Blind, blindness, conscious, consciousness, deaf, deafness, dizzy, dizziness, numb, numbness, lightheaded, lightheadedness, unsteady, unsteadiness. Point 2. Double vision, epileptic fit, prodromal symptom, syncopal attack, urinary incontinence or incontinence urinary, visual acuity. Point 3. A doctor is trained to determine the cause of loss of consciousness in 52 years old man. Complete the doctor's question. Look at C opposite and in the table in 26.1. Okay. Did you lose consciousness? Consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Passed out. Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious? Okay.